in this talk, there are three parts. The first part is I would like to tell you briefly about the profession of speech language therapy. And then in the second part, I will tell you a little bit about the curriculum in our program. And if you are interested in this program, the third part will be the requirements and procedures to apply to the program. So as you know, this is a program that prepares students to be in the profession of speech language pathology. So for you to think about whether this is a program that best match your interest and best match your future career plan, it's very important for you to know about what do speech language pathologists work, okay? What do they do, all right? So speech language pathologists is a helping profession, and we help with a range of disorders, okay? For example, speech, language, reading and writing, hearing, voice, and swallowing. So for children, for example, premature children, children with syndrome, such as Down syndrome, autism, or sometimes even typically developing children, they, for various reasons, they may not be able to produce speech clearly so that others can understand them, all right? So we call articulation disorders, so we work with them. And not just children, sometimes even adults, we also work with adults. They may have other issues. For example, after having a stroke, they may have aphasia. So they may not be able to produce speech sounds as accurately, as intelligibly as before. Also, some people may have some issues speaking fluently. So these are the populations that we work with. And these populations could also have problems formulating language to express their ideas. So you can imagine how hard it is if you cannot communicate your ideas to others. And sometimes it could be like for your whole life, you're very good at speaking, reading, writing, but after stroke, after an accident, after brain injury, you may lose your ability. So we work with them. And some children, they have particular difficulties encoding their ideas into writing, or decoding reading text and understand what it means, or even identifying the characters, for example. So we work with children with dyslexia, so reading and writing disabilities. And for people who have hearing loss, it could be since birth, it could be due to other reasons later. It will affect their speech and language. So we work with the population with hearing impairments. Also, if children or adults or teachers, they overuse their voice or misuse their voice, or sometimes there's pathology on the vocal folds, or there's cancer and then part or the whole larynx has to be taken out, there will be difficulties producing voice. So we help them using their voice appropriately, or using other devices in order to produce voice if they can't have their vocal folds or their larynx. And many people may not know that speech therapists also work with people with swallowing disorders. Swallowing includes drinking and eating. So imagine like you cannot share meals at festivals with your family. It's affecting the quality of life a lot, and it's also about life and death. So actually, speech language pathologists also work with people with drinking and swallowing disorders. All right, and for you to be a speech therapist, you will have to be able to work with a range of people, including not just the clients who may have different kinds of difficulties or disorders. We work closely with the families. We support also the family. We work with other health professionals and teachers. So this is an interesting and exciting job. If you like to work with these populations and doing something in this nature. And you will see that as a speech therapist, you work with people, you mostly, always, your job is about people. You care about people, and you care about people across the lifespan, and you care about people with and without different disorders. and you work closely with people with autism, Down syndrome, intellectual disabilities, stroke, cancer patients, etc. So if you like to help and you are passionate about helping people, improving their quality of life, this is a great profession. All right. What about settings? Okay, there are a number of settings that speech therapists work in. For example, government organizations. So you could work in the Educational Bureau, or you can work for the Department of Health at the Center of Assessment Center for Assessment Service, CAS. All right, at the Department of Health. You could work with little children in preschool centers or preschools. You could also work with school-age children and even university students. And if you like to work with older people more, you can choose to work in nursing homes. Or if you like to work with, you would like varieties, you can work in NGOs. They can serve people of different age range, hospitals, private clinic. You can even open your own private clinic. All right. So settings a large range to pick from. So let me tell you about the employment rates of the graduates in our program. Last year, the statistics for last year is not out yet. It's coming out soon. For 2019, 97% of our students are employed upon graduation. 3%, that student I personally know and very close to was decided to go for medical school. Okay, so that's the 3%. So to give you more details about the statistics, so about 40% work in NGOs, 30% in educational institutions, schools, 20% worked in hospitals, 14% in private practice, and 3% that student went for medical school. All right, that's the prospects of the profession. And the salary range, so the median salary is about 30,000. That's 2019. So if you find that, okay, you really like this kind of job nature, so then the next thing to ask is how to become a speech language therapist. So we want to have good training. We want to be well trained so that we can be competent therapists. So then you should come to Bachelor of Science in Speech and Hearing, Bachelor of Science in Speech and Hearing Sciences at Hong Kong U. All right, because this is the only government subsidized program undergraduate program. It's also the only 5-year program. We give you intensive training, full time. All right. So why I feel proud of this program, let me tell you more about the curriculum. We keep getting feedback from our students, and we modify our program. And we just have this new program we employed for a few years now, and I find it really good. Let me tell you more. Let's see what you think. So it's the translational learning. And what I feel passionate about this curriculum is that we do want our students to be independent, critical, and reflective thinkers. It's very important to be a therapist, okay? And to be able to integrate, synthesize, and apply what they know and their skills. Knowing it is not about knowing how to apply it appropriately, all right? And to be in a helping profession, it has to be evidence-based, and we care about people, and we care about build in the curriculum that we always train our students to be person-centered, to provide person-centered services. And nothing can be learned. You cannot learn everything in school. There's no way. And there's always new methods, new evidence, new science coming out. So we want our students to be able to self-direct learners so that they can keep learning on their own and pursue lifelong learning. Then you can feel confident, you can feel more competent when you go for your practice. So that is how we want to train our students. To be more specific, let me tell you about what we do in each year. So in year one, basically we give some introductory courses, which includes linguistics. So it's about language. So we study linguistics. We have anatomy and physiology, so some biology component into it. And then we have some introduction to human development, communication disorders. In the second year, it's more focused on science. So we will have courses on evidence-based practice, research methods and statistics, very important if you want to be able to understand new research coming out, good research studies, neurology, cognition, speech science, etc. And then in the third year, we focus on disorders, so speech language and pediatric. So speech and language developmental disorders, audiology, voice disorders, complex cases. The complex cases will be on pediatric, and fluency disorder, laryngectomy, craniofacial disorders, okay? And these complex cases, we have two, one in the third year on pediatric, and one on the fourth year on adult cases. And also on the, in the fourth year for adults, they will learn about swallowing disorders and adult communication, okay? Complex cases are the two signature courses. And in these complex cases, we gave students new, of course, complex cases so that they have a lot of data. They need to learn how to analyze the data and get information and apply their knowledge to design assessment and intervention, all right? To be evidence-based and person-centered, all right? And in the fourth year, they will take into professional practice, multilingualism, and a very important part will be they will work on a research project. They themselves will be scientists to produce knowledge and to produce a piece of research studies so that they know the whole process and so that they can understand each part and they can critically review journal articles out there. All right. They also so another line would be, so just now what I told you is about the academic side. There's another line will be clinical side each year. So they will have, for example, the first year, they will visit nursing homes, special schools. Second year, they will be in the internal clinic and then observe their senior students doing therapy, okay? And then the third year, they will have pediatric cases. The fourth year, adult cases. The fifth year, a range of settings and cases of clients of different ages. And they will also work in the hospitals, all right? So that's our curriculum. And all the clinical practica, they are supervised by experienced clinical educators and we stress about having experience in different settings, all right? And we always emphasize evidence-based and scientific practice. Here are some pictures about of the clinic at Kennedy Town Center, our internal clinic. And then here are the pictures about on the presentations, the students' presentations of their research projects. And some of these research projects, though they are undergraduate students, they published their research projects and even in top journals in our field. We are always very proud of their projects. Okay. All right, so after 5 years of training, students will be fully endorsed by the Hong Kong Institute of Speech Therapists. That means upon their graduation, they are qualified speech therapists that they can practice as speech therapists, all right? Okay, so now let me talk about the third part, admissions requirements and application procedures. So every year we take about 48 places, we have 48 places. We take in some non-JUPAS students, applicants and JUPAS applicants. We don't have a fixed quota. no matter whether you're a JUPAS or a non-JUPAS candidate, all of you will attend an interview in order to be considered to be admitted to the program. And we would like you to write a personal statement in your application. And for the JUPAS admissions requirements, the best way is to look up our website. You will find clear criteria there, all right? And we only consider applicants who put our program, if you're JUPAS applicants, you have to put our program in your Band A choices for us to consider giving you an interview and to move on in the process, all right? And this year, our interview is on June 18th, all right? I think it's a Friday. Let me talk briefly about non-JUPAS admission requirements. So we mainly consider applicants who have listed us as their first choice. They are proficient in English and Cantonese, and they can write Cantonese because, as you know, we work with children with reading and writing difficulties. So, and we serve the Cantonese and English populations, all right? And must have a biology component, and we consider them on a case-by-case basis, and also you have to attend an interview, all right? Okay, so I told you very, very quickly about the curriculum and everything. So you need to make the decision about whether this is a good profession for you, a good match for you, all right? So how do you prepare yourself? Okay, I think it's important for you, unlike other academic programs, for a professional program. So you want to know more about it, all right? What can you find? What can you do? You can search on the internet to look at our program, understand what you are going to learn or study, all right? Of course, you want to know about the admissions requirements, and you can go to the Hong Kong Association of Speech Therapists to look at information about the job, okay? And there are a lot of videos and information around that you can look up in then even YouTube. And here is one put up by our colleagues. You will see a lot of different clinical populations, children, how do you like working with them? What kind of difficulties they have, all right? And I strongly encourage you to go to NGOs, to volunteer, to observe, just to be with children, just to be with different populations, to see how they interact, and that will be really helpful for you to make a good decision about your choice, your future, all right? And then our students, they have a service group that they organize, and they go to different places to serve different disordered populations, so you can get on their website and get in touch with them. And a talk is coming up by one of our colleagues. So this kind of talks, for example, autism strengths and weaknesses in students with autism, you could also take part in it and to learn more about it. All right, so that's a very quick, very brief overview of our program. So, but if you have further questions that today you didn't get the question answered, or you come up with questions later, you can email us if you write to this email. All right, so I'm really happy to introduce the next part to you. I do feel, and I strongly feel that one of the strengths of this program is our students. Okay, they are passionate about their profession. They are very serious, capable learners. Okay, so being able to study together is a fun thing, and you learn a lot, maybe more, from fellow students. All right, so I'm really happy today that I can introduce to you two of our year 5 students, Christy and Yo-Yo. They will share with you their perspective of the program and the profession. All right, so maybe let me invite Christy first. Christy.
Hello everyone, I'm Christy Wong from the Year 5 class. Thank you for Dr. Wong's sharing, and let me talk about some of my own experience that we'll have for this program. I joined this program and wished to be a speech therapist because I was interested in the healthcare professionals. Before my admission to the university, my grandpa was in the hospital because of stroke and had swallowing difficulty. None of us in our family understands anything about it until a speech therapist came to assess on my grandfather. But as we all know, hospital is very busy and a setting with very high patient to clinician ratio. There was only a limited period of time that the ST could meet and conduct treatment on him. So personally, I would think that if more ST service could be provided, then families and patients will have much more better care. Therefore, I have a strong belief that this field should have more value and paid more attention to. We had placement in both child and adult settings, and cases ranging from children with speech sound disorders to children with special needs like autism spectrum disorder. I also have met adult patients that have stroke, dementia, or Parkinson's disease that need language, voice, and swallowing treatment. Going through child and adult placements in different settings like special child care centers, old age home, and hospitals, we can feel like how patients rely on us and each step of our treatment can affect a lot. I used to have an adult client with dementia, and at the assessment, she barely has any response to us or to the caregiver. However, after a few sessions of building up rapport with her and doing some cognitive stimulation therapy, now she could wave at me and give social smile, make some choices on her favorite singers as well. Her caregiver also said that the communication skills that we taught her was very useful and get response from the client as well. Undoubtedly, we'll face many difficulties during our 3 years of clinical practices and throughout the 5 years. We may run out of ideas of how to incorporate games into our treatment. We may find some cases more complex than others. Or even like now, because of the COVID-19, we had to change our mode to telepractice. And it's a very new thing for all the therapists, and we'll try to figure out how things work together with the clinical educators. Personally, I would recommend students, secondary school students, to try to look up on more different areas and populations that speech therapists would work in, as we do not only help children correcting their pronunciations or children with fluency disorders. Many people didn't know that we're also responsible for voice and swallowing assessments and treatments. Students can understand more about speech therapy's jobs in both child and adult populations as well. So let me pass the time to my classmate Yo-Yo to share some of her experience in the program.
Hi everyone. Thank you, Christy, for sharing. Good afternoon. My name is Yo-Yo, and I'm also a Year 5 student from Speech and Hearing Sciences. And it's my pleasure to be here doing a student sharing with you all. So the first questions that often come in mind is, why am I interested in this program? So imagine you spend 8 to 9 hours every day working after graduation. You do not just want a job which used to earn a living, but really helping people and bring positive impact to the society. So then I think about what I'm really interested in. Flipping through law books and fighting on the court, that's not my style. Consulting patient and prescribing medication or performing surgery, that's not my passion too. But instead helping people with their communication. Because to me, chatting, telling people about how I feel, sharing opinions are really some indispensable part of my life. And I can't really imagine how some kids or even adults lose such ability to do so. So such impairment impacts their life much more than you can imagine. And I really want to be a part of the speech therapist community and make changes in their life. And that's how I end up in choosing this program. And a part of all those curriculum details or admissions goals, I believe one of the biggest concerns from students would be about the program workload. So briefly speaking, as Dr. Wong has mentioned, we'll mainly focus on academics in our year 1 to 2, and we'll handle both academic and clinical placement during year 3 to 5. Personally speaking, I know it's kind of lame, but it really counts on your own time management. But I will also give you a picture to better gauge the workload. You'll be still able to participate in hall, student societies, volunteering, and interning, and like different organization or social enterprise during year 1 to 3, according to my own experience. But honestly, you do have to give up a beat, saying participating in student society or interning in year 4 to 5, because you really have to focus on your study as well as your performance in the clinic. But there are a few perks of studying speech and hearing in HKU. First, I would say is about our teaching staff. They are really understanding and caring, and they always ask if we encounter any difficulties in our school life or academic learning. They are always willing to help when you encounter difficulties, not just about your academic learning actually, but you can also seek advice from them concerning your career planning or even just your like school life. Besides, they also welcome and value our feedback for the courses or our workload a lot, and they would really modify the courses or experience to make it more functional and suitable for our learning. And the other perks of studying speech and hearing sciences in HKU is that the program structure is pretty considerate. You usually have like 1 to 2 days off per week. Depends on your schedule. So you don't have to be worried about overwhelming by your studies or like placement preparation, because you do have enough time to prepare well for them. So my little advice for all the secondary school students is that you really have to do more research about the program and don't be afraid to ask people around, not just some factual information such as admission score or the curriculum, on the official website, but more importantly is the experience of the current students. And I know there are a lot of questions in your mind, and please feel free to ask them in the following Q&A section. But I also understand that there may be some very personal questions that you don't feel like asking here. So if that's the case, you can now like take out your phone and open the Instagram app. I'm sure you all have one. You can search Speechugram, SPEECHU, and Gram as GRAM. It's an Instagram account owned by me, which used to advocate for speech therapy. You can all feel free to DM me for any question you have, and you can also like scroll through the account for some posts I need for JUPAS information and also some like interview tips for you all. So that's the end of our student sharing, and thank you all for listening.